Motherhood is an experience that is unique and special to each mother. There is no greater feeling than when you get your first positive pregnancy test, and the feeling of joy and hope that begins to course through your veins. But imagine waking up one morning and missing a new part of you. Waking up to having miscarried your baby. We are here to let you know that you are not alone. A miscarriage is a natural death of a fetus within 20 weeks of the pregnancy. A miscarriage is one of the most common pregnancy-related issues. The American College of Obstetrician and Gynecologists estimates that about 15 to 20% of clinical recognized pregnancies end up in a miscarriage. In fact, 1 in every 10 women experience a miscarriage during the process of trying to become a mother. Although it is common, it could be extremely traumatic and devastating experience. Many women may even have miscarried a baby before they even know that they are pregnant. The age risk in a woman who is under 35 have a 10% risk of miscarrying a baby, whereas a woman who is over 45 has a 45% risk. Most women who have miscarriage go on to having healthy pregnancies after a miscarriage. After one miscarriage, the predicted risk of having another miscarriage in the future is usually about 14%. The predicted risk increases to about 26% after 2 miscarriages, and after 3 miscarriages, it becomes 28%.
The types of miscarriage. Threatened miscarriage is when a woman may experience signs of miscarriage such as bleeding with a lower backache, but the loss of pregnancy has not yet occurred. Incomplete miscarriage is where some of the tissue from pregnancy has been expelled from the uterus, but some still remains. Complete miscarriage is where all of the tissues from the pregnancy are expelled from the body. Missed miscarriage is where the embryo dies, but the body does not expel the pregnancy tissue, and no symptoms such as bleeding or pain are experienced. A recurrent miscarriage is the occurrence of multiple consecutive miscarriages. An aseptic miscarriage is where tissues from a missed or incomplete miscarriage become infected. So, what causes miscarriage? The reasons for miscarriages are often reasons beyond control. In most cases, there's no way to prevent a miscarriage, and nothing could have stopped it. Miscarriage can happen for various reasons, including abnormal placenta development that interacts with the blood flow from the mother to the baby. Chromosomal abnormalities in the baby. About 50% of miscarriages are due to these chromosomal issues. Weakened cervixes, abnormally shaped wombs, poor diet, malnutrition, food poisoning, certain medication, uterine abnormalities, underlying health conditions such as high blood pressure, diabetes, kidney disease, HIV, malaria, gonorrhea, syphilis, thyroid gland problems, and lupus. The risk factors include obesity, old maternal age, previous miscarriages, illicit drug use, alcohol abuse, smoking, being underweight, and exposure to a workplace with hazards such as radiation or toxic agents, caffeine, and other various risk factors. Symptoms include abnormal bleeding, lower abdominal cramps, spotting, pelvic pain, lower back pain, uterine contractions, vaginal discharge that looks like mucus and has a whitish pink color, and the disappearance of pregnancy symptoms such as morning sickness and breast tenderness.
There are some tests available used to diagnose miscarriages, such as a transvaginal ultrasound placed in the vagina to check for the heartbeat of the embryo or fetus, a blood test to check hormones that are associated with pregnancy, or a pelvic exam to assess the cervix for thinning or any opening. Most miscarriages cannot be prevented, but there are some precautions that can be taken to increase your chances of a healthy pregnancy, which include alcohol, drug, and smoking cessation during pregnancy, maintaining a healthy weight before and after pregnancy. eating a healthy, well-balanced diet with plenty of folic and calcium, taking prenatal vitamins daily, limiting caffeine intake, attending all scheduled prenatal appointments as well as discussing all concerns with your doctor, immunizations against communicable diseases, and lastly, lighter, regular exercise to increase fetal health. No one is ever alone. Some resources to take advantage of if you or someone you know has or is experiencing a miscarriage include HANDS, Helping Hands After Neonatal Death, the MISS Foundation, PALS, Pregnancy After Loss Support, Return to Zero, HOPES, a support group, and Miscarriage Hurts, Hope After Loss. No one is ever alone.